Welcome, student, for your first aid overall session. On this session, we will be trying to cover the unit 3.3 and 3.4. So in this unit, we will be trying to tell you about the transfer technique and also fast evacuation techniques that we, as a first aider, will use in case of emergency situation. Like for example, any kind of accidents, we will be trying to tell you what all things we can do to make sure the persons are being pulled out from the danger. And also in the case of very most important critical conditions like any kind of head, neck, and spinal cord injuries as well. So let's begin with students. On this first thing, we will be trying to tell you about what all other type of evacuations are there. Like there are a lot of things like shoulder pull, ankle pull. So in this session, we will be trying to tell about the two types of pull that we normally used to do and also with the transfer technique in case of any other situations. So let's begin with about all those conditions. Next one, we're trying to tell you about the first off is the introduction. In the case of casualty is in danger situation, the following are the possible risk one rescue or evacuation technique to move an unconscious casualty over a very short distance to get them into a safety. Only one attempt to rescue a casualty if the scene is safe for yourself. So the first there are two different type of rescuer things. One is about the one-time rescuers, and there are multiple rescuers, multiple help rescuers, or the multiple helper. So in this situation, if you are alone, so what you will be doing? If you are alone, you can use two types of pull, that is shoulder pull or the ankle pull. Let's now start with the shoulder pull. So somewhat it will be like this. Here, grabs the casualty by the clothing under the shoulder. Keep your arms on the side of the head and also support the head as well. If the person is unconscious, the head might fall back. So it is very much important that you are making sure that head is also under the position. So hence your side, both the hands will make sure the hands are giving the support to the head. Try to pull the casualty in the straight line if possible. So this is the one method of trying to pulling or dragging up the situation or the casualty from the scene. Another one is the ankle pull. This method is the fastest method to move the casualty over a short, smooth distance. However, it is not preferred movement if the surface is very much uneven and bouncy surface. It may lead to the head to get into bumping. In this, grabs the casualty by both the ankles and pant cuff. So here, both the leg you need to try take it together and at least cuff it up so that you will get a anchor there. Pull the casualty. Use your legs to pull it up. Don't use their back. Maybe the because of the weight of the person, it can also affect your back. So make sure you're pulling it towards you with the help of your leg, not with your back. Don't give anything over your back. Pull the casualty in a straight line if possible. If the casualty is lying on the sheet, blanket, or plastic, whatever is it, underneath or beneath there, try to take them as well when you are pulling them out. So somewhat it will be in this way. Hence that's why it is called well, because the head is being not so much into a safer zone. Hence it is only for the shorter distance, very shorter distance, just to remove them out of the to the safer zone. Next is the important here is the transport technique. Now you have already evacuated the person from the or the casualty from the scene area of the crime or the area of accident. You have already evacuated them. Now it's time for you to transfer them to a particular facility or to even more safer zone, or maybe call it as you are transporting them to a stretcher. So in this condition, again there will be two types of I will be telling you, discussing about the two various type of techniques that you can do. You as a single person or a single rescuer or you with a multiple person. So this, after appropriate first aid is being given, the patient may need to be transported. Keep the following guidance on your mind. Position assumed by the casualty or in which he has been placed should not be disturbed unnecessarily. The person is having any sort of, as I told, head, neck, or spinal cord injury. You should not touch the patient unnecessarily or move them so much that it may worsen the condition. Throughout the transport, a careful watch must be kept on the general condition of the casualty, whether they are breathing, whether their consciousness is in the car or not. Any dressing that may have to be applied, any recurrence of the hemorrhages, and any signs of changes, like maybe their conditions are been worsening or not, whether the breathing is becoming faster, whether their consciousness level are being drooping down. We need to make a note of everything. Transport must be safe, steady, and speedy. The injured sick person may be moved into a shelter or the facility by the hospital by a single helper, as I told you before. In this, there are few techniques which can be held up. This hand seats and the kitchen chair techniques are only while used by the multiple helpers. Along with the blanket lift will also be the multiple helpers. Stretcher by also by the multiple helpers. Wheel transport, ambulance or car also by the multiple helpers. Air and sea travel, again, it is only for the staff. Like a trained staff under the paramedics will be doing the stuff. This method is to use and necessary to use more than one than the technique may be depend on. If someone is we are evacuated, at one point we are using this and the other point we may have to use the another technique to make them reach the facility. The nature and the severity of the injury. That is also matter. In case if it is a simple injury, we can usually use a very simple method to take them up. And if also depends upon the person also. If they are lightweighted, we can use any of the modality like techniques which we can. If the person is not so uh, heavy, they are in the medium way, we can easily use the two helpers. If they are very much heavier in the weight, then we have to think about the different areas or the places we can use with the multiple helpers. The number of helpers and facilities available. According to that, also we can make a judgment which type of technique we will be using to transport these particular patients or casualty. The distance to the shelter facility and the hospital. That is also very much necessary. If the facilities are very much nearby, we can acquire anything. We can try to take them to the hospital. But if it is a far away, then we need to adjust accordingly. The nature of the route to be covered. If it is very much bumpier, we need to make accordingly the placement of the cushions, pillows to make the casualty safer and beings fastened up with their beds. Single transport, single helper transport. So here the rescuer will be only one person. So what all techniques we can use if you are alone in that situation? If you are the only person available, following techniques can be used to transport a casualty. A cradle technique, the human crutch technique, a piggyback technique, or fireman's lift technique. So this is nothing but a cradle technique. Here, this technique is only being used in the case of the casualties very light or children. It is easier for the helper or the rescuer to pick them up as well, rather than making so much trouble on their back or on themselves. Lift the casualty by pressing one of your arm well beneath his two knees and one on around their back. Next one is the human crutch technique. In this technique, standing at the injured side, except where the injury is to an upper limb. If the person is having any injury to the shoulder, arms, or thing, may you try to stand where it is uninjured side, not on the injured side. Then assist the casualty by putting your arm around their waist, grasping the clothing at him, placing his arm around your neck, holding his hand with your free hand. In this, his upper arms are injured, or in his other hand are free. The casualty may gain additional help from the staff or the walking stick. If both the legs are injured, another first aider might hold the other side in the similar way. So it will be like human crutch with the two helpers. This is with the single helper. So if you can see in the um, picture here, you can see very well see that there is only one helper here who is helping him out on the other side, and this might be the injured one. So you are giving him a stable place on the here on taking his uninjured side and making him safer in this. Next is the pick a back technique. This is a very common technique which we can usually see in most of the rescue team, that is trying to pick them on their carry on their back, somewhat in this way. So this is very easy and very pretty much safer side also for the person if the casualty is very light. If the casualty is conscious and able to hold, he may carry in an ordinary pick a back fashion. Next is fireman lift and carry technique. It is used only when the casualty is not heavy for the bearer. Help the casualty to raise into an upright position. Grab his right wrist with your left hand. Bend down with your head under his extended right arm so that your right shoulder is level with the lower part of his abdomen, and place your right hand between them or around his leg. Taking his weight on the right shoulder, come to the erect position. Pull the casualty across both the shoulder and transfer to his right side to your right hand, so leaving your left hand free. This allows the helper also to move up or down a ladder which is carrying the casualty. Something like this. When they are trying to make the evacuation very much fast and transportation very much fast, they will try to put them on their back and they will move around. Next is multiple helper transfer. When there are multiple helpers are available, we will be following using the following technique. First is human crutch technique, which I have already explained to you. Same technique. On the other side, there will be one more person who will be helping around. Standing at both the sides of the casualty, both the helpers assist the casualty by putting their arm around her waist, grasping the clothing at him or her, and placing each arm on the other side of their neck, holding his hand with the free hand. So this is the way you will be using it as a human crutch technique. Next is hand seat technique. Hand seat technique is also known as four-handed seat technique. This seat is used when the casualty assists the bearer by using one or both arms. Two bearers will face each other behind the casualty and grasp their left wrist with their right hands and each other's right wrist with their left hand. It's usually like making a seat for each other. The casualty, the casualty is instructed to place one arm around the neck of each bearer so that he may raise himself to sit on their hand and steady himself during the transport. The bearer rise together and step off, the bearer on the right hand of the side of the casualty with the right foot and the left hand bearer with the left foot. The bearer will walk with the cross over step, not by the step basis. Somewhat like this, they will try to make the seat while they are holding each other's opposite side, like right wrist to the left wrist, and they will try to form a very firm seat. And then they will ask the casualty to sit upon it and raise himself up. Next is two-handed seat technique. In this technique, it is mostly used to carry the casualty who is unable to assist the bearer by using his arm. Two bearers face each other and stoop down, one on the each side of the casualty. Each bearer passes his forearm nearest the casualty's head under his back, just below the shoulders, if possible, takes hold of his clothing as well. This they slightly raise the casualty's back and then pass their other forearm under the middle of their thighs, grasping their hand. The bearer of the left of the casualty with this palm outward and holding the folded handkerchief to prevent hurting by the nailed fingernails. The bearer on the right side of the casualty with the palms on the tongue shown in the hook grip. The bearer raised together and stood off, the right hand bearer with the left foot and the left hand bearer with the left foot. The bearers walk across over step, not by the side step, somewhat in this way. It will be same like a seated one, but it will be not together, but they will be trying to put it like a chair kind of a situation here. Next is the fore and the aft method technique. In this method of carrying is usually used when the space does not permit a hand seat. One bearer stands between the casualty leg facing and feet with hands down, grasping the casualty under his knee. The other bearer will take the position behind the casualty. It's like the one person is in front and another will be on the back, and they will be facing each other's back. Like one will be facing one's back, and there will be one will be holding the leg or the knee under the knee area, and one will be holding the shoulder area. But they won't be on face to face. They will be on the be facing their back. One will be facing the back. So the other bearer takes the position behind the casualty and after raising his trunk passes his hand on the casualty's armpit, grabs his own wrist on the casualty's chest. Then the casualty is then lifted up. The bearer walks in step. The chair can also be used in this technique if they are trying to climb a staircase or ladder where the space is very much less, then we can call that particular situation as a kitchen chair carry technique as well. This is the way the aft method will be there. And this is the kitchen chair technique method. In this, the bearer will walk in step by carrying the patient in a chair. This is used when the casualty is lightweight and the distance is very small. The casualty allowed to climb up and down with the stairs, which is carrying the casualty. Next up is moving the transporting a casualty in the suspect of head and neck injury or the spinal cord. This is very important section. Why? Because most of the injuries to the accidents can happen to the head, neck, and the spinal cord injuries. But when the accidents happen, they might not be having such an impact on their spinal cord or to the neck or to the important areas which are there on the head neck area, but just during because of the faulty transfer procedure that we usually follow here can cause us a tremendous amount of problem to the casualty to the later hour just because of the transportation went wrong. So here there are the few steps which you can follow up in case you are handling a cases with the head, neck and spinal injury. To prevent further injury, the casualty with a suspected head, neck and spinal injury shall be handled with the greatest care. To transport the casualty suspected of head, neck, and spinal injury, they have to first prepare the stretcher because the transporting with the very finest and the hard surface is very important. So hence it should be a little bit stiffened up and let it be a little harder so that all the curves are being secured in there. The soft bed of the canvas type of stretcher must be stiffened, preferably by placing a short board across the stretcher and the long ones in the lengthwise of the canvas if they are available. If no stretcher available, a narrow shutter door board or at least something of same width and length as the patient might be used. If stretcher are not there, then improvise the situation by using any kind of a door, board or anything with the same length or size as of the patient can be used to transportation. Cover the stretcher with the folded blanket and then blanket the stretcher. Place the pillows pad in readiness on the stretcher in a position to support the neck, small part of the back. Those should be sufficiently large but not too large, they might prevent the. We just need to preserve the curves of the spine. Make sure they are adequately, make sure all these pillows are being set accordingly so that the back are being rested properly. Whenever the casualty is being moved or lifted, he must not bend, twisted or overextended. It is very much important. Any kind of slight movement of the spinal cord during the transportation, whatever happens, that can cause a fatal consequences for that. So we have to make sure that there are no such moments happening when we are lifting. So that first our bending, twisted, and the overextended position should not be happening over there. One bearer must firmly but gentle support to the head and face so that they prevent the neck movement, and another bearer must be steady and support the lower limb to prevent the trunk movement. This must be continue until the casualty has reached to the stretcher. When the casualty is not lying already on the blanket or rug, then what you have to do? Place the blanket or rug on the ground in a line with the casualty and roll on the lengthwise of the half of its width. While two of the bearer maintain the control of the head and lower limbs, other bearers should also carefully Turn the casualty on the side, every precaution being taken under against the movement at the site of the fracture. Place the roller portion of the blanket or the rug closely to the casualty's back and gently rolls them over the roll until he is lying on the opposite side. Unroll the rolled portion of the blanket or rug, gently lowering the casualties on his back so that he lies on the center of the open blanket or rug. The bearer at the head and the lower limbs conform to the ruling of the casualty throughout. Loading the stretcher. At that time, we have to be very much careful. There are two methods of the loading the stretcher. One is the standard method that we usually use with the blanket, which is already there underneath the casualty. Another one is an emergency method where there is a no blanket underneath, in which case the stretcher can be pushed under the casualty so that it will be necessary for the wearer at the feet to keep his leg width apart and allow the stretcher to be placed between them. A blanket lift is a standard method for loading the cases of the fractures the spine when the blanket is under the casualty. Roll the two edges of the blanket up against the casualty side. If the poles of the sufficient length and rigidity are available, the ridges of the blanket should be rolled around them. This will make the lifting of the casualty very much easier. While the two bearers maintain the support of the head and lower limb, the remaining bearers should distribute themselves as required on each side of the casualty facing one another. One word of the command, like 1, 2, 3, go. That go, everyone should be standing up. They have to act together. In case anything up and down, the casualty might lose all the sensation to the body. So we have to make sure that all the transportation are being at par. If this is for any reason impossible, the stretcher should be brought as near to the casualty as circumstance permits, and the bearer should move short, even sides paces until the casualty is directly under the stretcher, and it should be gently, cautionally moved. Then you have to place the casualty on the stretcher, adopting the same procedure as described in the blanket lift method, except the bearer grabs the rolled band, a jacket or the clothing or the bandage around the casualty's thigh instead of the rolled edges of the blanket. When the clothing is insecure, the broad bandage must be placed around the body just below the shoulder for the bearer to grasp. In the case of cervical injury, just try to put most of the sandbags or the roll up towards the side of the head to make the side of it steady. Place the folded blanket in the hollow above the heels so that they prevent the pressure on them. Walk the casualty. Next, if he is to be carried through a rough ground, reduce his body movement by minimum by binding him firmly to the stretcher but not too tightly. Just try to apply the force around the pelvis, thighs, and knee, and also on his arms and body, just below about the elbow, so that there is no movement, too much of movement on the bumpy area. On reaching to the shelter, do nothing, just wait for the facilities to come and give the medical attention that he needs. The above method of transportation of spinal cord is to be used only if the hardboard is not available. Then, what to do when you are transporting an unconscious victim? In this cases, the victims will not be conscious. He won't be able to tell you what is happening, what is not happening. They won't be there. The consciousness won't be there. So this time you have to be very much careful because this will be the important aspect in this. After giving emergency aid, the victim has to be placed on the large hardboard or inverted chapai. Secure them on the board and strap him. The head of the victim is to be secured very, very tightly. Breathing unconscious victim are to be placed in the recovery position and transport in that position. They should be observed continuously. If they stop breathing, they have to turn them up and give them CPR. Unconscious, non-breathing casualties are transported lying on their back while CPR is being continued. Unconscious patient, we have to check the few things, whether they are responsive, whether they are hearing our voice or their touch or to pay in response to any kind of stimuli. In case they are not doing anything and they are even not even breathing also, start the CPR immediately. In case they are breathing, try to make them as as firmly secured to the stretcher and then shifted to the emergency conditions or the attentions, medical attention that they require. If due to certain conditions, if it is not possible to rescue in a horizontal position, the vertical position may also be used. And if they are using the the position, make sure they are firmly place the person onto the hardboard, and then they are trying to transport them to the secured area. I hope all these transporting techniques are being very much clear to you. So next time when you find any kind of cases like that, when they are trying to transport, try to make sure that all are in sync. See how they are trying to do it, and also give some advice in case, because in the accident case where they are randomly go and just transport the person rather than knowing that whether there is any kind of head, neck, or spinal cord injury. So you are being now aware what to do in this situation. Please try to make sure the persons are getting the things that they need during the transportation and transfer. Don't make the condition worse. Now you are being aware. So I hope we will try to make sure that we are trying to do all these stuffs whenever we see any kind of a life situation over the roads. Thank you so much, students, for this class. I will be taking up our last unit, that is 4.2 and 4.1 and 2 on the next session. So stay tuned, guys. Thank you so much for the session. Thank you.